And welcome to Clinical Kinesiology. Make sure that you read through your syllabus, know why you are taking this class, and then let's get started. Okay, Chapter 1, Basic Information. Super important to really understand this chapter and actually the next few chapters in order to create a baseline for the rest of the units that you will be going over this semester. Kinesiology, so if we break that down, it combines anatomy, biomechanics, and physiology in order to understand human movement. Definition of anatomy, stop and think, structure of living things. Biomechanics, study of structure and function of biological systems. And then the physiology aspect, it's the science of the function of living systems. So this next little bullet we have here, PTs and PTAs will use kinesiology to determine what muscles need to be strengthened, what muscles are used during activities such as walking or standing from that seated position in an effort to help their patients regain the ability to perform those activities after an injury such as a broken bone or a stroke. So let me back up a little bit. PTs and PTAs are not here to truly diagnose. We have the diagnosis or whatever is to the best of the physician's knowledge. We are here to treat that diagnosis, and in order to treat a diagnosis you have to have an understanding of the kinesiology aspect. And so this example we have down below here is one of many examples that we will use throughout this course, but it's a true statement. We have to know what muscles are being used during activities so that we know where they lack strength, where they might be too tight or hypermobile in that area, and so on and so forth. You also have the neurological aspect in which if a patient has a stroke, you know, here we have weakness again, usually unilateral or one-sided, and so we have to have an understanding, I should say, of that diagnosis and how that is going to affect the actual body. So first we have to begin to utilize the same terminology to describe things. Basically we have to speak the same language, and that's across the board in the medical field. We must know what movement or motions are available at each joint in the body. So if I say elbow, we need to know that we can either bend or straighten the elbow. There's no other motions that are normal in an elbow. And we don't use bend or straighten in the medical field. We say flex and extend. Now when you're talking with a patient, you'll want to use layman terms, but for this course you will really start turning your mind towards those particular vocabulary words. Another example, hip and shoulder. These not only flex and extend, but they abduct, adduct, and rotate internally and externally. And you're going to learn throughout this little section what those words mean, if you don't already know. So over the next few slides, I've got some descriptive terminology for you to look over. What I have done is taken these particular terms, put them in a diagram for you all to look at. On top of that, as you can see at the top here, I've listed a specific YouTube video that you can watch in order to get a better understanding and have more visual for these specific terms. For naming movements at joints and location of structures, we have to have a basic starting position. That starting position is known as the anatomical position. So make sure you look in your book and read through what exactly the anatomical position looks like. You're standing, your eyes are forward, feet are even, and arms at the side of the body with palms facing forward. Fundamental position, only difference is the palms are facing the body. And here's a picture for you of the anatomical position. And feet are about shoulder width apart, but as long as the toes are pointed forward. When describing movement, we need to include the following. Super important: side of the body, whether it's right or left, the joint that is moving, shoulder, elbow, wrist, hip, knee, ankle, and so on, and the motion occurring. Are they performing flexion or extension or abduction? A few reasons that we do this, and we get used to it now for the sake of your patients and documentation. You need to make sure to have this information included in each section of your notes when describing the patient treatment. That is so that if anyone ever follows you, reads through your notes, and has to kind of mimic what you've done with that patient, they will know, that you treated the right side versus the left. Super important for insurance and legal documentation reasons as well. All movements do not occur at all joints. We talked about that with the elbow and knee versus the shoulder and hip. As we study the joints in this course, you'll need to know what movements occur at that joint. And we break this up into units so that you have a better understanding, but in this particular unit and in this particular chapter, we give you an overall idea of the motions. Okay, so in the next few slides, you're going to use your body and perform the motions yourself from the anatomical position as you say out loud the joint moving and the motion. Make sure you practice this. Something I would suggest for any online students, definitely go to look at videos on this, YouTube videos, read through your book. But if you get a chance and you end up in forum discussion, finding maybe a study partner or someone in the online course, the nice thing about this day and age is we can FaceTime each other, and I really think that would be helpful. If you can't meet in person, FaceTiming, super great. It will really help you and your partner when you are trying to figure these out, and it gives someone else an opportunity to bounce ideas off of you. Okay. In your book, you have, page 262. That skips way ahead in the chapters, but it's a good example of the lower extremities and their movements. Okay, so next is the upper extremity motions. Shoulder, you're going to find that on page 7 and 8 in the 5th edition lecture book. And then, of course, you're going to see these motions in upper and lower extremity on quizzes, assignments, and definitely the Unit 1 exam. I've also put on here another YouTube video for you all to look at. It basically goes over all of the motions that are occurring at each of the joints, and I think it's like 4 or 5 minutes, I believe, and it will, I'm sure, be very helpful to a lot of you. Okay, so I'm not going to go into too many details on these next few slides because you'll see them on the YouTube videos, as well as you all can read and actually perform yourself here, since you can't see me. Let's see, continued on, and then here's just a little snippet from page 262 in discussing the hip. And if you're taking an on-site course, we will go over these in class. Again, it will be helpful for you all as well when you are going through these to look at videos. Okay, so this picture is kind of blurry, but it gives you some details here on the positioning of this particular gymnast. What I would really encourage you guys to do, list the motions occurring at the right hip, right knee, left hip, and left knee. Make sure when you list these that you write down whether it's the left or the right, and write down which joint. I can't just look at this picture and say, oh, she's performing flexion. Well, where is she performing flexion at? And if I say knee flexion, well, that's true for one side, but what about the other? So make sure that you really practice those. All right, and here's your answers. Okay. We have to be able in kinesiology to see what motion is occurring at the joint, use the correct terminology. You're going to hear us say this a lot, whether you're in class or online, and it's because it is so important that you know these motions. Once you get into memorizing muscle origin and insertion, you'll have to memorize the action as well. And if you don't know what knee flexion is, then it's going to be really hard to envision that muscle and how it's working. Okay, and here's another little exercise for you all to do. Okay, and I would strongly recommend that you go through these. If you are taking an on-site class, we will have time to do these in class for the most part, and we can discuss. Okay, moving along into the two types of motion, and these are important to know as well, and that comes later. You'll understand why as we go throughout these chapters, and even in the program you'll understand. So we have linear and angular or rotary motion. Basically, the linear motion is a straight line from one point to another. Examples would be someone sledding down a hill, and then you've got, let's see, as far as the linear goes, it breaks up into two different types as well. You've got rectilinear, which is what I just talked about as far as the example goes, someone sledding downhill, and then curvilinear is one point to another but in a curved path. So an example would be a diver diving off of a diving board. And then angular and rotary, all parts move in the same direction at the same time, but not the same distance. So if you lay your arm on the table and then bring your hand towards your shoulder like you were lifting a weight in your hand and bending at the elbow, you are experiencing angular or rotary motion here, and all parts are moving towards your shoulder, and they're all moving at the same time, but you have a shorter distance closer to the elbow versus the hand to the shoulder. And so here are our examples. Two types of linear motions. Angular and rotary motion, or angular/rotary. Okay, planes of action. Here we are going to just go over this pretty quickly. These are fixed lines of reference along which the body is divided. There are three planes, each at right angles and perpendicular to the other two planes. So if you took any math classes, this may be, spark some memory there, but here we are going to talk about it in reference to the human body. So I posted yet another video for you guys to watch. I am a visual learner for sure, and some of you probably are as well, and so it always helps me to look at it and hear it being explained while I'm looking at a picture. So we have three planes of action, which are the sagittal, frontal, and transverse. Sagittal plane divides the body into right and left, and motions of flexion and extension will occur in the sagittal plane. Now here again, if you're in the online class, go to these YouTube videos. I strongly encourage you to, because you will begin to understand why we consider that the motions of flexion and extension will occur in this particular plane, just like the ab and adduction will occur in the frontal plane. If you are taking an on-site class, we will give examples in class and help you to understand this a little better if you are having some trouble with that. I think a good rule of thumb for me with a lot of these is in the sagittal plane. If you were standing there looking at someone who has their side exposed to you, so you're looking at their profile, what motions can you really see all the way through the range in that position? And so in the sagittal plane, if you're looking at them from their side view, you see how flexion and extension fully occur in that particular plane. So I can see how far they fully flex their shoulder and how far they fully extend their shoulder. And same with the hip here. Same with the knee flexion and extension. So if I were to stand here and look at them from the front and they performed these particular motions, flexion and extension, I would not be able to see their full range. Transverse. This is where internal and external rotation occur, and so if I were to stand on a chair and look down at the top of this person's head, I could see them turn or rotate their head from, say, left to right. So that's that rotation that occurs, and I can see their full range if I'm looking down on them. And to tie it all in, you have an axis, sagittal, frontal, and vertical. And then here you definitely need to memorize these, and you've got the different planes and then what axis goes along with that plane. And again, the YouTube video should explain this for you visual learners, and your book will explain as well for those that just understand by reading through. Hard to explain without kind of showing you as well.